Approximately a quarter of kids who have a healthy birth and nearly 3/4 of disabled children have trouble eating. And we are very fortunate in this community to have the only intensive feeding program in the entire Southeast Florida region. Taylor Thomas and Paula Henderson from Bethesda Hospital are here to share more. Good morning, lady. Thank you guys so much for coming in.
Thank you.
Taylor, a large segment of our viewers, they still don't know about this program. So give us a little tidbit on what it is.
Okay, so actually in 2016, me and my colleague Andrea Alifano, who have been working with children with feeding disorders for a long time, developed this program where children would come to the hospital and eat 3 meals and have 1 occupational therapy session as well. So it's 4 therapies a day, all 5 days a week for 8 weeks. It's a very intensive program. It enables us to work very closely with the families and just really make a lot of progress in a very fast amount of time.
So how do those families know, do I just have a picky child, a picky eater, or is it something more serious?
Well, a lot of parents will come in and complain their child is a picky eater. We hear it a lot, and they complain to their friends or their pediatrician. A picky eater usually is a child that has age-appropriate oral motor skills. They can safely eat, the foods that are provided to them. They usually don't have trouble gaining weight, and they usually eat, at least a few things in every food texture or food group. And they don't completely fall apart if a food they don't like is maybe put on the table. Whereas a child with a feeding disorder, these children have a very limited diet, either in their ability to eat the food, maybe due to sensory processing difficulties, they don't like the way it looks, smells, feels, tastes, or their oral motor skills are underdeveloped, and so they have a difficult time with managing the food textures.
As a parent who's watching this, when do you know something might not be quite right? It's time to bring in some help.
Yeah, one of the biggest things that we see is children that are refusing food because of pain and discomfort, like maybe from undiagnosed reflux, constipation, food allergies that are really on the rise. And so if a child's frequently gagging, vomiting, coughing with meals,
those are probably some red flags.
Really big red flags, yeah.
All right. Paula, you guys have a luncheon coming up pretty soon, and this really helps fuel the work that you guys are doing.
It does. It's the 19th annual Women of Grace Luncheon, and it is lovely because we honor 5 women and 1 local high school student from our community, and with the fund raised, we are going to support the Center for Pediatric Development in Bethesda and hopefully expand our feeding program.
Seeing some pictures there of some of the kiddos in that program. That's fantastic. Where is the luncheon?
The luncheon is at the Delray Beach Marriott. We do still have tickets available, and I would encourage anyone that's interested to help us honor women that volunteer in our community. Join us. It's very inspiring, and it's very uplifting.
We've got the details again, Monday, November 5th. That is the day to go, the Delray Beach Marriott. Thank you all so much for stopping by, and thank you for the work that you do. We appreciate it.
Thank you.
All right.